Dear Dedalus friends and family, I'm here today with a good friend, Dari Alhuwail, who is actually at the University of Kuwait. Dari, good to see you.
Likewise.
I have a few questions for you. I mean, you're obviously teaching at the university. You have a lot of experience in digital transformation. I would love to hear your thought on what digital transformation means for you.
So digital transformation for me and for many people, as a matter of fact, means a change of culture. Means embracing this new change, which often can be quite difficult. But if we do it appropriately and purposefully with a plan and a set of KPIs, I think we will reap the benefits. Otherwise, it will be a missed opportunity.
That's great. I get this question quite often, and that is, where do I start with my digital transformation journey? And I find it hard to give people an answer because it really has a lot of dependencies. How would you answer that question?
I would answer it almost the same way,
Okay.
except I will say it will depend, right? But I think oftentimes when we think of this problem, it's a complex problem. We're dealing with an ecosystem, we're dealing with people, we're dealing with change, project management. And you'll notice and you'll see at every institution, they're at a certain level or varying levels of where they're at, or what are the challenges that are facing them, or the opportunities that are ahead of them. Timing also matters,
Absolutely,
right?
yes.
And I'll end with this, right? So there isn't any change or transformation that's going to happen without having the support and buy-in from all the stakeholders, whether it's the leadership or the people on the ground.
Great answer. That's definitely the right way forward. We talk a little bit about the last 5 years and the moves and the changes that we've seen in the entire eco-health system. What do you think is going to be the next 5 years? What do you see being something that we're all going to be looking forward to in terms of the technology?
So, again, not having a crystal ball per se, but I suspect that we're going to see more, not necessarily only engagement from consumers, but more demands. Digital will be the new way for us to deliver healthcare, and it's going to be part of doing business as usual.
Right.
So perhaps maybe now we're seeing the uptake, and especially after the pandemic, and how people quickly adjusted to many changes that unfortunately were forced on us. But I think into the next 5 years, I think we're going to see more demand, and that's an exciting opportunity for everybody that's working in this space. It's going to be super amazing.
That's the first time anyone's said that. I think everyone's talking about AI and virtual healthcare, but people are forgetting the demand that's going to be coming through. So we're going to see, I'm sure there's going to be many of your students looking at this, and many other people who are potentially coming into the healthcare industry and the informatics industry. If you had to give one or two pieces of advice to them about how they can maneuver and meander through this industry, what would you tell them?
I would say number one would probably be embrace change and also connect with like-minded individuals. I think we're very lucky here in this region, this part of the world, that we have many fantastic organizations, whether it's the International Medical Informatics Association or HIMSS, and there are many really to cover. And being associated with these associations, attending some of their events, doing some of their even trainings or what have you, I think will set you on the right path. Because at the end of the day, I'm excited to welcome everybody to this growing community. It's about collaborating and cooperating with each other.
Great. Some very wise words there. Thank you so much, Dari. Good to see you.
Thank you.
I'm sure
Likewise.
we'll see you again soon.
Inshallah.
Take care.